Hi everyone, welcome back to my YouTube channel, and today we are going to talk about pharmacodynamics. So let's start topic with introduction. Pharmacodynamics is a core branch of pharmacology that focuses on biochemical and physiological effects of drug on the body. While pharmacokinetics describe what the body does to the drug, pharmacodynamics explains what the drug does to the body. It helps scientists and healthcare professionals understand how drugs produce therapeutic effects, side effects, and toxic reactions. Pharmacodynamics is essential in designing effective and safe medication and determining appropriate dosages. Definition: Pharmacodynamics is defined as a study of mechanism of drug action, including how drugs interact with biological targets such as receptors, enzymes, and ion channels. It examines the relationship between drug concentration and the resulting effect, allowing prediction of drug effectiveness and potential toxicity. Basic principles of pharmacodynamics: they include drug receptor interaction, that most drugs act by binding to specific targets called receptors. These may include cell surface receptors, intracellular receptors, enzymes, ion channels, and transport protein. The interaction between a drug and receptor initiates a series of biological responses. Drug affinity and efficacy. Affinity is the strength with which a drug binds to its receptor. Efficacy is the ability of drug receptor complex to produce a desired biological response. A drug with high affinity and high efficacy is usually produce a stronger therapeutic effect. Third is dose response relationship. This describes how the magnitude of the drug effect changes with varying dosages. First is graded dose response, and second is controlled dose response. Graded dose response shows continuous increase in response with increasing dose, while controlled dose response shows the percentage of population that respond at different doses. Understanding dose response helps determine the minimum effective dose, optimal dose, and toxic dose. Fourth is potency and maximum effect. Potency refers to the amount of drug needed to produce a specific effect. A more potent drug requires a smaller dose. Maximum effect is the highest response achievable with the drug regardless of the dose. Mechanism of drug actions. It may be agonist, antagonist action, partial agonist action, enzyme inhibitors, ion channel modulators, and transporter blockers. First is agonist. These are drugs that bind to receptor and activate them to produce a biological response. Examples include adrenaline and morphine. Second mechanism is antagonist. They are drugs that bind to receptors but do not activate them. Instead, they block the action of agonists. Their examples include antihistamines and beta blockers. Third mechanism is partial agonists. These are drugs that produce a weaker response compared to full agonists, even at full receptor saturation. Fourth is enzyme inhibitor. These are some drugs that act by blocking enzymic activity, resulting reducing the formation of harmful substances or showing biological processes. Examples include ACE inhibitors in hypertension. Fifth is ion channel modulators, that are drugs that can open or block ion channels, influencing nerve transmission or muscle contraction. Their examples include calcium channel blocker. Next mechanism is transporter blocker. They are drugs that prevent the uptake or release of neurotransmitter or other molecules. Examples include antidepressants. Theories of drug receptor interaction include occupancy theory, two-state theory, and rate theory. Occupancy theory. In this, the drug effect is proportional to the number of receptors occupied by a drug. Second theory is two-state theory. According to this, receptor exists in active and inactive form. Drugs stabilize one of these states to produce effect. Third theory is rate theory. According to this, the drug effects depend on the rate of the drug receptor interaction rather than the number of occupied receptors. Factors influencing pharmacodynamic response include age, genetics, disease condition, drug interaction, tolerance and desensitization, and psychological factors. Age. Infants and elderly individuals may have altered receptor sensitivity affecting drug responses. Second factor is genetics. Genetic differences influence receptor structure and enzyme function, thus affecting drug response. Third factor is disease condition. Diseases such as liver failure, heart disease, or hormonal disorder can alter receptor function. Fourth factor is drug interaction. One drug may enhance or inhibit another drug effect through shared pathways. Fifth factor is tolerances and desensitization. According to this, long-term drug use may reduce effectiveness due to decreased receptor sensitivity or number. Sixth factor is psychological factor, as placebo effect shows the psychological state that can influence perceived drug action. Therapeutic window and safety. Therapeutic window is the range between the minimum effective concentration and the maximum toxic concentration of the drug. Therapeutic index is a ratio indicating the safety margin of the drug. A higher the therapeutic index means a safer drug, while a lower therapeutic index requires careful monitoring, like warfarin. Adverse drug reaction. These include side effect, allergic reaction, toxicity, and idiosyncratic responses. Understanding pharmacodynamics helps reduce adverse effect and improve drug safety. Clinical applications of pharmacodynamics include drug selections, as physicians choose drugs based on potency, efficacy, and safety profile. Second is dose adjustment, as clinical adjust dose based on patient factors like age, genetics, and disease state to achieve optimal drug response. Third is predicting side effects, as knowledge of drug action helps anticipate and manage adverse effects. Fourth is therapeutic drug monitoring, as drugs with narrow therapeutic window require careful monitoring of blood levels to maintain safe concentration. Fifth is drug development, as researchers use pharmacodynamic principles to design drugs with improved efficacy and reduced toxicity. Pharmacodynamics versus pharmacokinetics. Although related, pharmacodynamics and pharmacokinetics describe different aspects of drug action. Pharmacodynamics. What the drug does to the body is pharmacodynamics, that include mechanism, effects, and potency, etc. Then there is pharmacokinetics, that is what the body does to the drug. For example, absorption, distribution, metabolism, and elimination. Together they form a complete understanding of drug behavior and therapy. Conclusion of this lecture video. Pharmacodynamics is essential for understanding how drugs produce their therapeutic and toxic effect. It explores drug receptor interaction, dose response relationship, potency, efficacy, and mechanism of action. Knowledge of pharmacodynamics allows healthcare professionals to prescribe drugs safely, predict their effect, and minimum adverse reaction. Along with pharmacokinetics, pharmacodynamics form the foundation of rational drug therapy and modern medicine. And this was all about pharmacodynamics. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.